Meconium aspiration syndrome, also known as neonatal aspiration of meconium, is a medical condition affecting infant newborn. It occurs when meconium is present in their lungs during or before delivery. Meconium is the first stool of an infant composed of materials ingested during the time that the infant is spent in the uterus. Meconium is normally stored in the infant's intestines until after birth, but sometimes, often in response to fetal distress and hypoxia. It is expelled into the amniotic fluid prior to birth or during labor. If the baby then inhales the contaminated fluid, respiratory problems may occur. Signs and symptoms: rapid or labored breathing, cyanosis, slow heartbeat, barrel-shaped chest, low Apgar score. Diagnosis: listen with breath sounds, crackles, and rhonchi. ABG, chest X-ray, will show irregular infiltrates, hyperexpansion. In severe cases, there is labor consolidation. Treatments: is the child vigorous? Strong respiratory effects, good muscle tone, heart rate is greater than 100 beats per minute. Continue normal steps? Yes. Suction mouth and trachea endotracheal? No. Meconium aspiration syndrome, or MAS, refers to breathing problems that a newborn baby may have when there are no other causes and the baby has passed meconium stool into the amniotic fluid during labor or delivery. MAS may occur if the baby breathes in aspirate this fluid into the lungs. Causes: meconium is the early stool passed by a newborn soon after birth. It passes from the body before the baby has started to digest breast milk or formula. In some cases, the baby passes meconium while still inside the uterus. This will happen when babies are under stress because their supply of blood and oxygen decreases. This is often due to problems with placenta or the umbilical cord. Once the meconium has passed into the surrounding amniotic fluid, the baby may breathe meconium into the lungs. This may happen while the baby is still in the uterus or still covered by the amniotic fluid after birth. The meconium can also block the infant's airway right after birth. It can cause breathing problems due to swelling, inflammation in the baby's lungs after birth. Risk factors that may cause stress on the baby before birth include aging of the placenta if the pregnancy goes far past the due date, decreased oxygen to the infant while in the uterus, diabetes in the pregnant mother, difficult delivery or long labor, high blood pressure in the pregnant mother. Symptoms: some babies do not breathe the meconium fluid into their lungs during labor and delivery. They are unlikely to have any symptoms or problems. Babies who do breathe in this fluid may have the following: bluish skin color, cyanosis in the infant, working hard to breathe, noisy breathing, grunting, using extra muscles to breathe, breathing rapidly, no breathing, limpness at birth. Exams and tests: before birth, the fetal monitor may show a slow heart rate. During delivery at birth, meconium can be seen in the amniotic fluid and on the infant. The infant may need help with breathing or heartbeat right after birth and may have a low Apgar score. The healthcare team will listen to the infant's chest with a stethoscope and may hear abnormal breath sounds, especially coarse, cracky sounds. A blood gas analysis will show low acidic blood pH, decreased oxygen, and increased carbon dioxide. A chest X-ray may show patchy or streaky areas in the infant lungs. Treatment. A special care team should be present when the baby is born if traces of meconium are found in the amniotic fluid. This happens in more than 10% of normal pregnancies if the baby is active and crying. No treatment is needed. If the baby is not active and crying right after delivery, a tube is placed on the infant's airway by a nurse, therapist, or doctor. Suction is used to remove any meconium. This procedure may be repeated more than once. If the baby is not breathing or has a slow heart rate, the team will help the baby breathe using a face mask attached to a bag that delivers an oxygen mixture to initiate the baby's lung. The infant may be placed in the special care nursery or newborn intensive care unit in order to watch closely. Other treatment may include antibiotics to treat infection, breathing machine, ventilator not commonly needed. Many problems can develop while the child is using a breathing machine. Oxygen to keep blood level normal, radiant warmer to maintain body temperature, surfactant to help lung exchange oxygen, nitric oxide, also referred to as NO, an inhaled gas, to help blood flow and oxygen exchange in the lungs. ECMO, extracorporeal membrane oxygenation, is a kind of heart-lung bypass. It may be used in very severe cases. Prognosis. In most cases, the outlook is excellent and there are no long-term health effects. Only about half of babies with meconium stained fluid will have breathing problems and only about 5% will have mass. Breathing problems may be more severe in some cases. These will often go away in 2 to 4 days. However, rapid breathing may continue to several days. Mass rarely leads to permanent lung damage. Meconium may be present at birth in the amniotic fluid because there is serious problem with the blood flow to and from the lungs. This is called persistent pulmonary hypertension of the newborn, or PPHN. Prevention. Staying healthy during pregnancy and following your healthcare provider's advice can often prevent problems that lead to meconium being present. Your provider will want to be prepared for meconium being present at birth. If your water broke at home and the fluid was clear or stained with greenish or brown substance, any testing done during your pregnancy indicates there may be problems present. Fetal monitoring shows any signs in fetal distress can be found early. Alternative names: meconium pneumonitis, inflammation of the lungs, and labor meconium, delivery, neonatal meconium, newborn care meconium. For the information gathering, visual assessment. History of meconium colored amniotic fluid, often with full-term infants. Infants may have meconium staining about the body, may demonstrate grunting, retraction, nasal flaring, poor color or cyanosis. Bedside. Patient contract assessment. Apgar score between 0 and 6. Basic laboratory assessment, ABG, hypoxemia with respiratory acidosis, metabolic acidosis, or mixed. Chest X-ray, bilateral densities, and widespread atelectasis. Decision making. Remove the meconium from the airway, if possible. Suction the baby as soon as the head appears from the birth canal. Intubate to facilitate suctioning. Re-intubate if the tube becomes clogged for any reason. Mobilize secretion with chest physiotherapy, mechanically ventilate only if needed,